Well, good morning, everyone. Bob Ravenscroft, the Vice President for Advancement, here for this week's first media briefing. I'd like to welcome Chris. I see you're online. I guess I don't miss seeing it, but it was sort of fascinating watching you late nights a few weeks ago, so glad you're okay. Before we get going today, I'm going to ask in a minute for Jeff to roll a video. Throughout this process, our interns, Paige Heineman and Munib Kulavak, have been making little videos for our staff. Some of them go externally facing. Later today, we're going to distribute this to all of the people that donated so generously to us, and then certainly during Facebook Live. So before we get to the stats, we're just going to play this quick video. Certainly more for our Facebook Live audience than the media, but the media might find enjoyment out of this 1-minute video too. So go ahead, Jeff. Why don't you roll that video? Well, I hope you enjoyed that. Again, the outpouring of support from the community, from PPE to just your kind words, your gifts for our employees were tremendously helpful. Again, helped bridge that gap until the supply chains got back in control. And just can't say enough about how our community responded for Bryan and how our community has participated in helping keep the curve relatively flat here in Nebraska. With that, we have now administered 11,326 tests at Bryan Health facilities, including our drive-through, the urgent care, mobile clinics, and then in the hospital. And our positives results are now at 1,479, and we have 322 pending results. John Woodrich will come up, provide a little bit more flavor and some insight on what's going on inside the medical center. And then we have a special guest with us today, Kelsi Anderson. She's the provost at the Bryan College of Health Sciences, and she will be sharing some of the plans for bringing our students back this fall. So with that, John, it's all yours.
Thanks, Bob. As Bob shared in regards to our pending numbers, we are seeing about a 2-day turnaround from our outside lab, which has been very good. Our positivity rate is at about 12.8%, and that excludes our mobile unit. And I think as we've shared before, those utilization of our mobile unit goes to what we call little hotspots. From an inpatient perspective, we have 11 positive COVID patients in-house, 7 from Lancaster County, 4 from outside the county. Only 5 individuals on ventilators, which continues to be great news. 5 individuals in our ICU unit, 1 in our progressive care unit, and 5 in our general care unit. With that, I'm going to turn it over to Kelsi.
Thanks, John. Good morning, Blue Healers. My name is Kelsi Anderson, and I'm the provost at Bryan College of Health Sciences. While most of the students have been away from BCHS since March, exciting things have still been happening throughout the healer community, including the graduate nursing program being awarded the Nurse Faculty Loan Program Grant to provide tuition assistance to doctoral and master's educator students. The new class of Doctor of Nurse Anesthesia Practice students started in May. Many new undergraduate nursing graduates have already passed their licensure exam and are working in the hospitals. Biomedical sciences grads have been accepted to medical and physician assistant school. Sonography graduates are getting jobs, and new certified nursing assistants and phlebotomists are entering the essential workforce. That's a lot of great news. Today is June 15th, which is our first of 3 promised updates regarding fall semester plans. At this time, we are simultaneously preparing for 2 different scenarios. The first is to teach most lecture courses remotely, with a few exceptions, with all clinicals and labs resuming in the face-to-face format. While we are planning for that, we hope that we can actually offer most lecture courses in the face-to-face format. Our decision is dependent on the gathering size limit as determined by the governor and mayor in conjunction with the Lincoln-Lancaster County Health Department. At this time, the gathering size limit is 25 people. Using that guidance, we do have a handful of summer courses that are running in the face-to-face format with social distancing and safety top of mind. In the event that we are able to and decide to hold most classes face-to-face in the fall, we will be dividing courses into multiple sections to accommodate smaller group sizes. We are already working on this, and if we do make that decision, student class schedules will be adjusted automatically by our records and registrations team. We do not plan to alter our academic calendar, which you may have heard of some other schools doing. We will start the fall semester on August 24th. By next week, we will post registration guides on our website that reflect these 2 scenarios so our students have a bit more detail on how classes will be offered. However, these scenarios will not yet be updated in our online registration system. Our final decision for course delivery will occur on August 1st. We will provide an interim update on July 15th. Please do not hesitate to contact me if you have any questions or concerns about this plan or update. Thank you so much. So we know that about 15 of our graduates have taken the NCLEX or the licensure exam at this point, and 100% of those have passed. And about half of them half of our total class usually end up working in the Bryan Health system. So right now, there's probably 7 or 8, though we don't have that employment data for sure at this time.
Yeah, we actually use those robots quite a bit in disinfecting certain areas. But also, if you recall, when we first started to use that, we were using it for our N95 mask. And we found that utilizing that UV, we can reutilize those masks up to 5 times. We've also discovered at the same time we have a sterilizer called a SteriRad type of unit. And we're able to sterilize those masks up to 10 times so they can continue to be reused. And the last time I had heard, and this is a few weeks old, we were doing about 950 of those a week. So that's just 950 less N95s we needed to go out there and try to find in the market. So both of those technologies have been very useful for us.